now that it's Thursday morning, a little after 8:30, it's time to get into What's Up, Doc, where we spend some time with the experts at Mercy Health. We've, I don't know who's gotten more out of this. Well, I know the doctors and other medical pros haven't.
They have not.
No, but we have. Because we have learned a lot from these experts who are nice enough to draw the short straw and be forced to come in and interview with us.
Very nice.
Well, this morning, no exception. We're going to meet our new friend now. That's Dr. Funminiyi Taylor. Dr. Taylor, good morning.
Good morning. How are you?
Good. How are you this morning?
I am doing well. And it was not the short straw.
Oh, you guys have another method?
Rochambeau.
They just walk in and go, okay, you're the one. It's your turn. Everybody else has to suffer. It's your turn. There's a whole bunch of letters after your name. Will you explain to us what they are?
So the MD is the doctor of medicine. After going through the 4 years of medical school, once you graduate, you receive either that or a DO. And then the FACOG is for being board certified in obstetrics and gynecology. So once you're board certified, you get the FACOG.
And where did you acquire these letters from? Where did you matriculate?
So I went to medical school at Howard University and undergrad as well.
Okay.
My residency training was at the Mayo Clinic in Rochester.
Oh, I've heard of them.
Yes, and my fellowship was at the Ohio State University in Columbus, Ohio.
The Ohio State.
Yeah.
The Ohio State.
See, yeah, Joe draws a hard line on colleges and where everybody's from due to being a fan of different teams and all that. Does she check all the boxes? Is she okay?
Ohio State's in the group.
All right.
That's fine. That's
Awesome.
fine.
Make sure.
Yeah, not a problem.
Go Buckeyes.
I would hate to think we got off on the wrong foot over the Ohio State.
Big game on Saturday versus Oregon. Good luck.
Oh, I'm sure we'll do fine.
Oh, wow. Confident.
I like that confidence. Dr. Taylor, tell us a little bit about you. What spurred the interest in medicine to begin with?
Well, to be honest with you, whenever I was younger, there were a number of people in medicine in my family and also close family friends, and they would always take me around to them, whether to the lab. My mother's a researcher. She was involved in drug development, so I spent quite a lot of time with her in the lab and, other family members. My stepfather, for example, I would go with him to the hospital and round with him, and being able to see the transition from lab to real-world application and the types of relationships that they had with their patients as well in the hospital and outside of the hospital. I really saw it as a field where I could make a difference in people's lives by helping them when they are, not doing as well in, using whatever tools we have available to bring them into better health and support the quality of their lives.
That's outstanding. So a natural-born streak of empathy along with kind of the family business at the same time.
I suppose.
Were you allowed to play with like the spectrometer or the centrifuge when you went to the lab with your mom?
I was not allowed to touch anything.
Okay.
I had to sit there quietly.
Wow, dude. I don't know if you would have made it.
I would not.
If you had been going in there with her mom, I get the idea her mom would have been slapping you across the hand a lot.
It would have been a problem.
A lot.
Would have been a problem.
Let's talk a little bit about COVID-19 and the vaccine and pregnancy. I read a piece the other day that's saying that there's a pretty high percentage of pregnant women who are reticent and really, really pondering this whole vaccine thing. What's your take on this?
Well, unfortunately, I think some of it just goes with the disinformation that's out there that's causing a lot of pregnant women to be skeptical of the vaccine, and it makes sense. Nobody cares more about her unborn fetus than a pregnant woman. And even when I was pregnant myself, it was taking that step back, and it's almost like you're making decisions on what you think is best for baby, because that's the mindset we're in.
Sure.
Protecting baby. So if there's so much information out there that this vaccine might cause untoward harm towards my baby, as mama bear, of course, the first thing you're going to say is, no, I don't want it.
Right.
So it makes sense to me.
If a pregnant woman, we were talking about getting vaccines for pregnant women, is this more of protection of the mother? Does this also protect the baby, or do both get the protection?
So both get the protection. The primary protection is for mom, but the baby benefits as well because we know that those antibodies cross the placenta to the baby. There have been reports now of babies tested for the presence of the antibodies within 2 weeks of birth, and the antibodies are there. So we know that they could only have received it from mom being vaccinated. But there is also protection in moms who receive it postpartum as well. Some of these antibodies are present in breast milk as well. So not all is lost if you don't get it during pregnancy. If you get it postpartum, there is some protection if you are nursing baby.
And just to clear it up, you talk about antibodies being present in the baby. Now that's you're not being, when you get a vaccine, you're not being injected with antibodies. The antibodies is something that you create as a response to it. If I'm correct on that.
That's correct.
So does anything that is in the syringe that goes into the mother's arm, does any of that end up ostensibly in the baby?
It does not. So the antibodies that the baby gets are mom's antibodies that cross the placenta. So the way the mRNA vaccine works, it's actually quite beautiful if you think about it. It's not virus that replicates, but essentially what they do is they code parts of the virus's protein into the mRNA. Like our body makes protein by reading the mRNA. The mRNA is the map that tells you how to get to where you need to. But the map itself does nothing if you don't follow it. So the mRNA is a map for our immune system to form little pieces of the protein of the virus, but we're forming those pieces to the protein. It's not viral at all. So our body is being tricked into making antibodies to our response to the mRNA, if that makes sense. Mm-hmm. And the mRNA degrades rapidly. So it's not in your system and it lasts a long time. It doesn't cross the placenta. It doesn't do anything. They inject it. A bit of it is absorbed. Your body sees it, reads it, makes a protein that's similar to the viral protein particle, and then your body responds to that protein because it's still technically foreign to you. You get that response.
You said a couple times it does not cross the placenta. Is that because it's not present in the mother's body anymore, or is that because it has
exactly?
Or is that it's not because it's already dissipated throughout the body?
It's already dissipated.
Okay, gotcha. Mm-hmm. There's no barrier in the placenta that says no vaccines can get through here or anything like that.
Well, no, there is the placental blood barrier is incredibly. It does a really good job at keeping foreign substances out. So even, I'm not sure if they've done any placental studies to look at cross-reactivity if you were to put a high amount of the mRNA vaccine, but it should not cross that placental maternal barrier.
All right. I want to not topic hop, but hop over to another question along the lines of, what we're trying to do is get rid of the COVID to begin with. What is all this Delta variant that we keep hearing about and the rise of it in COVID cases? What does that mean for pregnant women who are and who are not vaccinated?
So the viruses are incredibly smart. Like any organism out there, we want to survive. So once any virus realizes that we're now starting to develop immunity to it, it's going to mutate to a form that is more likely to be present and to propagate. So the issue with the Delta variant is there's a term called R0, which is how many people will one person get infected. With the original Alpha variant of the coronavirus, it was 3. So one person would infect 3 people. With the Delta variant, it's about 8. Okay. So one person could infect 8 people. So it's a lot more transmissible, and the disease course is actually a little bit more virulent. you're more likely to get sicker with the Delta variant than you would with the original.
We've seen the Delta variant too start to infect younger children, school aged. Have you guys found it infecting down to the infant level?
They're not at our institution that I'm aware of, but yes, there are studies and cases out there, I should say, where there have been even congenital infections where baby got COVID from mom prior to delivery or at or around the time of delivery.
Okay. So and just again, I mean, so a vaccine isn't busting through the placenta barrier there. The COVID infection would pass through that, though, right?
There have been cases of COVID being transmitted congenitally to the baby.
Okay. I'm just in my own head. I have a number. I'm curious as to what it is. How many times a week are you asked this very line of questioning by a patient, and do you sit down and come out with the really well comprehensive explanation that you just gave us?
Well, I tend to bring it up whenever I see any patient.
Okay.
I ask them if they're vaccinated, and if the answer is no, why? And that way I can get a general understanding of what the hesitancy is, where it stems from, so I can address it.
And there are cases out there of people that are not vaccinated that are medically advised not to do that. Is there anything within the pregnancy realm that would add an expectant mother to that list of people that shouldn't get the vaccination?
Unless the short answer to that is no. There really shouldn't be a reason why a pregnant mom cannot get vaccinated. Of course, unless they've got allergies to components of the vaccine itself. But outside of that, it's very, very safe for moms to get vaccinated. I was actually pregnant when the vaccine came out, and I was one of the first people in line here to get the vaccine. And obviously I was incredibly concerned and worried. I had my mother watching all the FDA advisory things when I was at work and I couldn't watch it. And she would send me updates and we would go through all the data safety stuff together. We would read it together. Started researching the mRNA vaccine. It's been out for over 18 years. Like, they've used it for cancer therapeutics and also animal studies for preventing babies from getting infected from moms having viral infections like cytomegalovirus that causes a monotype viral infection, and can have really adverse effects for the baby. They've done animal studies for Ebola, for rabies virus, and using mRNA vaccines in animal models that are similar to human pregnancies, that demonstrated that those babies were actually protected from those viruses without any side effect of the vaccine. Like, those babies were more likely to survive, were more likely to be of normal weight than the animal models that didn't receive the vaccine. So I felt pretty confident knowing that there was no data in pregnancy to get it when I was pregnant. And I'm glad I did, because at least I know little man is protected, and protected by what he got through me. But at that point, the CDC actually started V-Safe, I think it's called, where if you were pregnant and you received the COVID vaccine, either Pfizer or Moderna, you could enter a registry and you entered your information. And there are over 800 pregnancies, the most of them completed without any increased risk of miscarriage, stillbirth, preterm birth, structural abnormality in the baby. So far it's proven itself to be safe for baby and safe for mom, because the goal is to prevent mom from getting severe COVID.
Dr. Taylor, you've been fantastic in your explanations, all of these things, breaking it down to where even guys who are on the radio can understand all of this. We're up against the clock. Before we let you go, is there anything that we have not asked you that you wanted to make sure got out today?
I just want to stress to everybody that really the only way we're going to be able to make it through this pandemic is to get vaccinated. We need to stop this virus in its tracks. If we don't, it'll continue to mutate. The more it mutates, the harder it'll be to get rid of, the longer it'll be with us. And we're all tired. We all want to spend time with our families. We all want to travel again. Let's do it for each other. We'll do it for our families, do it for our community, do it for the world. Let's do our part in stamping this COVID out.
Dr. Taylor, thanks for carving time out of what we know is a very, very busy schedule, even though you wink, didn't draw the short straw.
I did
not. We really appreciate you being on with us, and we would love to talk to you again sometime.
Absolutely. Anytime. Have a great day.
And Dr. Taylor, congrats on the new kid, and go Buckeyes this Saturday, okay?
Amen.
There we go. That's Dr. Funminiyi Taylor from Mercy Health.